Hey girls, so it is time for my week 25 pregnancy vlog, and it's been an interesting week. Some things have happened, and if you follow me on Facebook, I did put a status update about it. But so Monday night I got a call from my hematologist, and he got all my lab work back, and he was like, I think you should come in tomorrow for a transfusion. And I was kind of surprised because he thought that my body was attacking my red blood cells and that a transfusion wouldn't do me any good. But he said it turns out the test came back and it didn't look like that was happening, so I wouldn't need the prednisone, and that a transfusion should take care of the anemia. So it was good news to me. I don't know why I favored a transfusion over prednisone, but I know that it's a category C drug, and I know every single doctor I talked to said that transfusions were safe for the baby and for me, and you know, they're really common, and they didn't even really tell me any risks, except that you could have a reaction or like an allergic reaction to the blood. But he made sure that he tried to do everything he could to prevent a reaction. So what happened is yesterday I went into the hospital early in the morning, and they take some blood and start an IV, and they need to find a match for you. So that's what they take the blood for. They type you and they find out your RH factor. They weigh you and take your blood pressure and take your temperature. And then it can take up to, they told me, 4 hours to find a donor match for your blood type. And so they did that, and they kind of moved me to another room. My doctor came in and said hi, and he's such a nice guy because I didn't have an appointment with him, but he just kind of stopped in to see how I was doing. And my husband went with me too, so he met my husband. So we waited for the blood for probably like 2 hours, I would say. A half hour before they were ready to transfuse me, they came and gave me pre-meds. They just pre-treated me with Tylenol and Benadryl, and that if you do have a reaction, it kind of prevents the fever that comes along with it, which could be a risk in pregnancy. So, and the Benadryl is to like make sure you don't get itchy and things like that. So I just had those pre-meds. They just gave me a little bit of saline through the IV, and then they started the blood, and I got 2 units of packed red blood cells with reduced leukocytes, I think. I don't know exactly, but that's what the doctor told me they were going to give me. And each unit took 2 hours or so to transfuse, so it was a long, long day. And then basically when they're done, you just, they unhook you, like your IV, and they take your vitals and send you home. That's pretty much all there was to it. It's just a kind of a boring day. But you can have reactions, so it could be serious, but I did fine. So yeah, that's how the transfusion went, and I am excited to say I feel so much better. I can do normal things, and I don't get tired. I've just been like nonstop today getting things done because I feel like I can. I don't feel like I need to go lay in bed for the whole day when my son is sleeping. So today it's only 11:30 in the morning, and I've done dishes and I'm on the 3rd load of laundry now. I packed some of Connor's old toys away. I reorganized his play area. I swept the floors in like our downstairs area. I've just been like going all day, and I feel fine. That's just a huge, huge change. Then a couple other things I noticed since the transfusion. I'm not getting out of breath. I can go up and down the stairs without my heart racing and without getting out of breath. So that is awesome. And I do have like what I would assume would be normal for pregnancy, like as far as breathlessness, but like I can actually function and not need to stop and take breaks and try to catch my breath and things like that. So that's pretty awesome. And another thing, you probably can't tell because this camera is not that great and I'm in the basement, so there's not good lighting, but my face has color in it again. Like I don't know, there's some pink in my face now. I'm not so pale. And I have a list over here too I'm looking at because I kind of wrote things down. My hands and my feet are warm, and they are like never warm. My husband was like holding my hand. He's like, your hands are warm. And I'm like, I know, they're normal. They're not ice. So that's pretty cool. And I woke up at 4 in the morning feeling more rested than I felt like for a couple months. I made myself go back to sleep because I was like, I can't get up at 4, then I will still be tired tomorrow. But yeah, I woke up feeling rested, and that was pretty awesome. I think transfusions are supposed to last between 90 and 120 days. So that will hopefully get me to delivery or close to it. And then after, I'm having an exaggerated response to the thalassemia that I carry because I'm pregnant. So once the pregnancy's over, hopefully I can do a good enough job keeping my levels up on my own. But I do follow up with the hematologist in February, so a couple months postpartum, just to make sure that everything did level itself out. So baby is kicking a lot, and I have a Doppler and I check her every couple days. Her heart rate has been in the 130s, and yesterday I checked and it was like up in the 150s. So I don't know if she's really liking the fact that I have more blood that is better oxygenating her mama. I don't know, but she seemed to be doing pretty well. And she's kicking a lot. The kicks are not this week or punches down towards my cervix. I feel them more on my sides, and so that's great because they're not really uncomfortable like they were. And as far as baby buys, we bought a ton of stuff this week because we got our 20% off coupons. I was able to get a handful of those, and we also got quarterly bonuses at work, my husband and I. So we got our crib. We bought, I put in 2 more diaper orders. We got, I'll see if I have a picture of it, but the Fisher-Price Sleep and Play or something, little bassinet, which I'm going to put down here in my office, so when Connor's napping, if the baby's napping, I can bring her down here with me and work so that she's not 2 stories up like Connor is when I'm working. I bought some long sleeve undershirts, which is not like a big item, but I still bought those. Because they finally are out for the season. So, and I had a boppy, but I bought a little girly cover for the boppy, and it has the little birds on it that match the theme in her room, and it's so soft. And if you're a breastfeeding mama, you'll appreciate a nice cover that is soft and that you can cuddle up with because you spend a lot of time with that. I know we bought other stuff, but I can't remember right now. Our crib is on back order, so I don't have it yet, but it's paid for, and when it comes in, then I'll go get it. And our mattress came in. We had ordered that a couple weeks ago, so that's in her room. And yeah. Okay, so next Tuesday, I have an OB appointment, and I'm supposed to do my glucose test. But I can't remember, when you guys had blood drawn for your glucose test, do they actually take like a vial, or do they just do a finger prick? Because honestly, I really don't want them taking any blood out of my body right now. I just don't. I'm probably going to call ahead of time because I'm really not interested in them taking the blood that I just got out to test my blood sugar for a test that's not 100% necessary. when I know they can just check your blood sugar levels from a finger prick, and I would prefer that because when they draw blood from me, my veins always blow, and then they have to throw that blood away. And one time recently, not when I had the transfusion, but the time before that when I had blood drawn, they had to prick me here, 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 here. They blew all 4 veins. They finally had to get, like, I don't know, their head lab person to come in and, like, wrap my hand in a heat pack and, like, really get my veins to pop. And anyways, they threw like 5 vials of blood in the trash, and that couldn't even be used in the lab. And they actually did that the time before that when I had blood drawn too. They blew 2 veins before they got blood. So I'm really hard stick, and I really don't feel like having my blood thrown into the trash. So let me know if you guys know. I can't remember how they take the blood, but if you guys remember, let me know. And like I said, I am going to call my doctor too and ask, because yeah, I'm not interested in losing this good blood that I got. I'm pretty thankful for it and appreciate my donor. And all the blood that I got came from the same person, the same donor. And I don't know if you guys have seen a unit of blood, but it looks like so much blood to give away. So if any of you guys donate blood, thank you so much. I know I personally probably didn't get yours, but it really does help people in emergent situations and people like me who don't function really well without it. So I go to the chiropractor Friday, and I'm super excited because I have a nerve that I feel, depending on how I sleep at night, I'll wake up and it will be pinched in the morning, and I'm looking forward to getting adjusted, so hopefully that stops happening. But it's like right at the top, it's like right in the joint of my left leg and my hip, and it hurts when I put weight on my leg. I usually can work it out throughout the day by doing like some pelvic tilts or stretching or something, but I'm excited to get adjusted. And okay, so I will do the name reveal. I put something on Facebook and in the last video, and I didn't make it difficult to guess, just because, but everybody who guessed right. Her name's going to be Annabelle, and we really need help with a middle name, so let me know if you guys can think of any names. We kind of like Lee, and we like Elizabeth or Marie for middle names, but we're kind of looking for something short, because her Annabelle is a long name, and so is our last name. So we like Lee, but there's that poem Annabelle Lee, and so that kind of makes us lean towards not using that name. But let me know if you guys think of any good middle names for Annabelle. I will show you the belly, and then I think that's it for this week. So I don't feel like I'm growing very much, and I'm still in pajamas. I was actually all dressed today, and then I decided I was doing housework and I was not comfortable, so I changed into pajamas. There's the belly. This is not a maternity shirt. This is a nursing shirt, actually, so there's room for a little belly in it. But there she is. I don't know, in the camera I think I'm growing. There you go. I'll show you with shirt up here. And the belly button hasn't popped yet. It didn't with Connor at all. It just like completely flattened. So that's what I'm waiting to happen this time too. There she is. Little Annabelle. Yeah, so she's growing, and I'm doing so much better. And for the girls on Facebook, thank you so much for the prayers. I'm so happy everything went well. Yeah, I think that's it for this week. So if you guys have any questions, leave them as a comment or message me. But thanks for watching. Bye, girls.